Hello everyone, today we'll be talking about acute otitis media. So, acute otitis media, this basically refers to inflammation of the middle ear that is commonly associated with pain, fever, irritability, anorexia, or vomiting. So, basically, when we say otitis, that refers to inflammation of the ear, and media basically refers to middle. Okay, 60 to 70% of children have at least one episode of acute otitis media before the age of 3, and 18 months to 6 years of age is the most common age group. Then the peak incidence is between January to April, while this is referring to the months of winter, so they may vary depending on what country you're in. Then one third of children have had 3 or more episodes by the age of 3. So common etiological agents include Streptococcus pneumonia, which is responsible for 35% of the cases, Haemophilus influenza, which is responsible for 25% of cases. Then we have got Moraxella catarrhalis, Staphylococcus aureus, and Streptococcus pyogenes, anaerobes, which is most common in newborn, and viral infection. So what are the predisposing factors? So the first thing is that we need to look at is the eustachian tube dysfunction or obstruction. So this can be due to swelling of the tubal mucosa. So what leads to swelling of tubal mucosa? It may be due to upper respiratory tract infection, allergies, allergic rhinitis, chronic sinusitis. Then another cause of eustachian tube dysfunction is obstruction or infiltration of eustachian tube, osseum. Okay, so that can be due to the tumor such as nasopharyngeal carcinoma in adults, adenoid hypertrophy, adenoid hypertrophy, which is not due to the obstruction but by maintaining a source of infection. Barotrauma suggests sudden changes in air pressure. Then inadequate transapallary function, which may be due to cleft palate even after repair. Abnormal spatial orientation of eustachian tube, such as in Down syndrome, Cushing's, and Apert syndrome. Then disruption of action of cilia of eustachian tube, mucus secreting cells, capillary network that provides humoral factors, PMN, phagocytic cells. Then immunosuppression or deficiency due to chemotherapy, steroids, diabetes mellitus, hypogammaglobulinemia, cystic fibrosis. So basically what you need to know under predisposing factors is what can lead to the development of otitis media, right? So there's eustachian tube dysfunction or obstruction. Then there's disruption of action of the cilia, mucus secreting cells or our immune cells. Then also immunosuppression. What are the risk factors of developing acute otitis media? Bottle feeding, passive smoking, crowded living conditions, or sick contact, being a male, family history. So, what is the pathogenesis of acute otitis media? So, basically, there's obstruction of the eustachian tube that leads to increased air being absorbed in the middle ear. So, when there's increased air being absorbed in the middle ear, that leads to the development of negative pressure. And negative pressure is an irritant to middle ear mucosa. This leads to edema of mucosa with exudate formation, and then then there's infection of the exudate. So, what is the presentation of acute otitis media? So, we have a triad of otalgia, fever, and conductive hearing loss. So, otalgia basically refers to ear pain, and fever is more common in younger children. Then there's otorrhea, that is in case if of tympanic membrane is perforated. So, otorrhea basically refers to draining from the ears, okay? Then there's pain over mastoid. Infants or toddlers may present with ear tagging, irritable, poor sleeping, vomiting and diarrhea, anorexia. Then if you do otoscopy of the tympanic membrane, you might notice hyperemia, bulging, and contour of handle of malleus and short process disappear. So this is more common in middle ear effusion. So, what is the pathology and the clinical features? So, the disease runs through the following stages. So, basically, what you need to know is the 5 stages. So, the first stage is stage of tubal occlusion. Second stage is stage of pre-separation. Third stage is stage of separation. Fourth stage is stage of resolution, and the fifth stage is stage of complication. So, let's look at them in details. So, stage of tubal occlusion. So this is whereby there is edema and hyperemia of the nasopharyngeal end of eustachian tube. that blocks the tube leading to absorption of air and negative intratympanic pressure. There is retraction of tympanic membrane with some degree of effusion in the middle ear, but fluid may not be clinically appreciable. So that's basically the pathology. So what symptoms are you going to see in the first stage? So the symptoms would be deafness and earache. Basically, there will be some hearing loss. Okay. Then earache. However, they are not going to be very marked, and you might not notice any fever. Then the signs are tympanic membrane is retracted with handle of malleus assuming a more horizontal position, prominence of lateral process of malleus, and loss of light reflex. Tuning fork test shows conjunctive deafness. Okay. Stage 2 stage of precipitation. If tubal occlusion is prolonged, pyogenic organisms invade tympanic cavity, causing hyperemia of its lining. Inflammatory exudate appears in the middle ear, and tympanic membrane becomes congested. So the symptoms include marked earache, which may disturb sleep and is of throbbing nature. Deafness and tinnitus, which is basically ringing ears, are also present, but complained only by adults. Usually, child runs high degree of fever and is restless. If you remember, in the first stage, fever was not pronounced. However, here you're going to have a high degree of fever. In the signs, so in the beginning, there'll be congestion of the pars tensa. Leash of blood vessels appear along the handle of malleus and at the periphery of tympanic membrane, imparting it a cartwheel appearance. Later, whole of tympanic membrane, including pars flaccida, becomes uniformly red. Tuning fork test will show conductive type of hearing loss. 3. Stage of suppuration. This is marked by formation of pus in the medial ear and to some extent in mastoid ear cells. Tympanic membrane starts bulging to the point of rupture. The symptoms include earache, which becomes excruciating, deafness increases, which is basically the hearing loss gets worse. Child may run fever of 102 to 103 degrees Fahrenheit. This may be accompanied by vomiting and even convulsions. Then the signs include tympanic membrane will appear red and bulging with loss of landmarks. Handle of malleus may be engulfed by the swollen and protruding tympanic membrane and may not be discernible. A yellow spot may be seen on the tympanic membrane where rupture is imminent. In pre-antibiotic era, one could see a nipple-like protrusion of the tympanic membrane with a yellow spot on its summit. Tenderness may be elicited over the mastoid antrum. Then, if you do an X-ray of the mastoid, you will be able to see clouding of air cells because of the exudate. Stage 4 Resolution. The tympanic membrane ruptures with release of pus and subsidence of symptoms. Inflammatory process begins to resolve if proper treatment is started early, or if the infection was mild. Resolution may start even without rupture of tympanic membrane. So the symptoms include basically after the evacuation of pus, the earache will be relieved, fever will come down, and the child will feel better. Signs: external auditory canal may contain blood-tinged discharge which later becomes mucopurulent. Usually, a small perforation is seen in anterior-inferior quadrant of pars tensa. Hyperemia of tympanic membrane begins to subside with return to normal color and landmarks. Then first stage of complication. So basically if we looked at stage 4, that was stage of resolution. However, there may be a stage 5 which basically refers to stages of complication. So when do you get to this stage? So this happens if the virulence of the organism is high or resistance of patient poor. Resolution may not take place and disease spreads beyond the confines of medial ear. It may lead to acute mastoiditis, subperiosteal abscess, facial paralysis, labyrinthitis, patrocitis, extradural abscess, meningitis, brain abscess, or lateral sinus thrombophlebitis. So basically, these are just the complications that you may face from acute otitis media. So treatment. So you obviously have to give antibiotic treatment which hastens the resolution. Usually it's a 10-day course and the first line drug is amoxicillin. And after this, literature differs. Others say that you can give amoxicillin and clavulanic acid. Other literature says you can give trimethoprim and sulfamethoxazole if the patient is penicillin allergic. Acute otitis media is deemed unresponsive if the clinical signs or symptoms and otoscopic findings persist beyond 48 hours of antibiotic treatment. So, what do you do if it's unresponsive? So, you need to change to a broad spectrum antibiotic. that is our cephalosporins. You can go to clavulin, erythromycin, and sulfasalazole. Then you can also use cefixime or clarithromycin for recurrent acute otitis media. Then you have to give antipyretics for acetaminophen, which is our usual Panadol. This you can give it for the fever. Then there is no role for decongestants in acute otitis media. Then you can do a meningotomy with tube. So when would you go for meningotomy? The indications are complications of acute otitis media suspected. So basically, if you're suspecting any of the complications, you need to do a meningotomy. Then, due to recurrent acute otitis media, which is basically if you have greater than 5 episodes in a year, 3 immunologically compromised child, 4 failure of 3 different antibiotics, fever, and bullying of drum. Then another treatment that you can do is adenoidectomy. So basically, the treatment of acute otitis media is antibiotics, antipyretics. However, if necessary, you can do a meningotomy or an adenoidectomy. So, what are the complications of acute otitis media? So, we can divide them into extracranial, intracranial, intratemporal, extracranial, and intracranial. So, intratemporal complications include mastoiditis, basically inflammation of the mastoid, petrositis, inflammation of the petrous part of the temporal bone, labyrinthitis, facial paralysis, labyrinthine fistula. Then extracranial complications include retropharyngeal abscess, parapharyngeal abscess, lymphadenitis. Intracranial complications include extradural abscess, subdural abscess, brain abscess, meningitis, sinus thrombophlebitis. Then what are the sequelae of otitis media? So basically these are the direct result of medial ear infection and should be differentiated from complications. So these are not complications, they're like a sequelae. So the first thing is perforation of tympanic membrane, 2 ossicular erosion, 3 atelectasis and adhesive otitis media, 4 tympanosclerosis, 5 cholesteatoma formation, 6 conductive hearing loss due to ossicular erosion or fixation, 7 sensory neural hearing loss, 8 speech impairment, 9 learning disabilities, and the last is secondary to loss of hearing in the developmental phase of the infant or child. So that's all about acute otitis media. Thank you.